There was a time when our hospital was considered the top choice clinic for many monks. Hello, I'm Lee Suick, Chief Director of Modubo Clinic, Daegu branch. Today, I'd like to explain a bit about scar hair transplantation. I just finished a procedure, so my hair is a mess, and I haven't dyed it in a while, so it's almost all white. We perform scar hair transplantation quite often. Scar hair transplantation generally addresses everything from very small to large scars, but it is quite challenging. Achieving high density is the hardest part, and first, we need to determine why the scar formed. I have to ask the patient, why did you get this scar? What caused it? You must ask, and the fat layer under the scalp is also crucial. For instance, if it's a burn patient. If there's been severe burning and almost no fat layer remains, with just skin attached to the bone, it can indeed be quite difficult. In such cases, we perform fat grafting. Of course, we're not a clinic that specializes in fat grafting, but our plastic surgeon knows how to do it, and we have the equipment for it. We take some fat from the thighs or abdomen and perform fat grafting first in areas where there's none at all. After fat grafting, we observe for 3 to 6 months. If it's successful, we then transplant hair onto it, which increases the engraftment rate. And also, there are cases where the cause of the scar is unknown. Scars from childbirth, fungal infection, or hardened scalps from severe seborrheic dermatitis with significant keratinization actually show good engraftment, provided the underlying fat layer is adequate. However, high-density transplantation might be challenging. Let's say you were injured in a traffic accident. When you touch it, it's very hard. Even when the blade goes in, the resistance is significant. Because it's packed with fibrous tissue, there's a high chance there aren't many blood vessels there. So, in tissue with few blood vessels, transplanting at a high density could actually kill all the hair follicles. Therefore, if the fibrous tissue here is very dense at first. If this scar feels a bit hard, I lower the density for the transplant. So, I transplant at a lower density, and the hair follicles will have brought many blood vessels with them to engraft. Then, the blood vessels will have grown to some extent. Then we can transplant there again, letting the blood vessels grow and grow, and it turns out fine. The scar hair transplantation can grow in very nicely. I have a close friend who is a professor, and he's a neurosurgeon. He truly is a dedicated professor. So, that friend of mine refers patients to me. When you undergo brain surgery, the scars can be quite large, you see. But if the scars are large, they can split, making them noticeable. It's unsightly, so we transplant there. Nowadays it usually works well, and actually, incisional surgery is becoming less common. Statistically, incisional hair transplant isn't performed much, and people are very sensitive about the pain and expect it to hurt. So many opt for non-incisional hair transplant, but they still have scars from past incisional surgeries. For those with large scars, a full transplant is needed. Even smaller scars become visible when the head is shaved, so many desire a transplant. There too, transplantation yields good results. I believe I've mentioned this on several occasions before, but there was a period when our clinic actually became the top choice clinic for many monks. Many monks came, and there was a time when our waiting room was filled with people in monastic robes. These individuals had lived secular lives before entering monastic life, and some had undergone incisional hair transplants, so they have a scar remaining on the back of their heads. The front transplant healed well, but since there's a scalpel mark on the back, and they always have to shave their heads, it bothers them. They asked for a transplant there, so we performed it, and it turned out well. It's so good you can't tell unless you look very closely. Then, word got around, and that monk began referring other monks to us. I distinctly recall many monks coming to our clinic. Also, regarding scars, many people are now getting facelifts, aren't they? They sometimes make the incision inside the hairline, and for women, they have sideburns like this. If there are sideburns, the skin is pulled and cut from the inside, which can sometimes lead to the loss of the sideburns. Or they cut inside the ear, and when they pull the skin, the sideburns are lost too. And the facelift leaves a white line scar. We also do transplants there, and that's a scar too. We do a lot of those these days. Thus, scar hair transplantation is increasingly performed for scars resulting from burns, brain surgery, traffic accidents such as car or motorcycle accidents, and facelifts. So, if you have any worries or desire a scar hair transplantation, please do not hesitate to contact our clinic. We will make it beautiful for you. Today we explored scar hair transplantation. I'll return with a new topic next time after dyeing my hair. My hair is so white today, I'm completely grey-haired. While some people appreciate grey hair, my children actually dislike it. They even call me Grandpa. Well, that's all for today. I'll see you all again next time.